Arm behind the thigh, as you can see, this is a cyst, and it's an epidermoid cyst. You might be wondering, what is a cyst and why does it happen? In this video, we will answer these questions while demonstrating the procedure. So first, let's learn about an epidermoid cyst. Epidermoid cysts are typically harmless, slow-growing bumps under the skin. They often appear on areas with more hair, such as the scalp, face, trunk, upper back, or groin area. This cyst can range in size from half inches to several inches across. Some may have an enlarged pore in the center of them. They are the most common type of skin cutaneous cyst. Epidermoid cysts are sometimes called epidermal cysts. They are sometimes incorrectly called sebaceous cyst. But a sebaceous cyst is different from an epidermoid cyst. They are also less common. True sebaceous cyst start in the sebaceous gland. This is an oil gland in the skin that produces an oily substance called sebum. Sebum lubricates the skin to help keep it healthy. Epidermoid cysts can remain stable. Sometimes they will become inflamed, red, painful, or suddenly rupture. This poses a risk for infection. So now, let's learn about the causes of epidermoid cyst. Your skin has several layers. The thin protective outer layer of the skin is called the epidermis. The cells that make up the outermost layer slowly shed and are replaced as a newer cell move to the skin surface. Most epidermoid cysts are caused when skin cells move under the skin surface. These cells continue to multiply, like skin does normally. They then form a wall around themselves and secrete normal skin fluid that's called keratin. This is a thick, yellow substance that may drain from the cyst. This may be developmental, but it's happened because of an injury to the skin. So now we'll learn about what are the symptoms of epidermoid cyst. Symptoms of an epidermoid cyst may include feeling a lump just beneath the skin. It may be painful. The cyst may smell bad. The cyst may become inflamed or red. The cyst may leak fluid or thick materials. The symptoms of epidermoid cyst may look like other skin conditions. Always talk with your healthcare provider for a diagnosis. Now we'll talk about how are epidermoid cysts diagnosed. A healthcare provider can often diagnose an epidermoid cyst by examining the cyst. A tissue sample can be taken and looked at under the microscope. Now let's talk about how epidermoid cysts treated. Epidermoid cysts often go away without any treatment. If the cyst drains on its own, it may be returned. Most cysts don't cause problem or need treatment. But if a cyst is a concern to you for any reason, see your healthcare provider. Epidermoid cyst can be treated by simple surgery with a removal of the cyst and cyst wall, and that's called cyst sac. An epidermoid cyst that is inflamed can be injected with steroid. This can reduce inflammation and the cyst may not need to be drained. Now we'll learn about what are the possible complications of epidermoid cyst. Large cysts may become annoying or painful if they press on surrounding skin. They may also become unsightly. Inflamed cysts may become infected. This infection can spread to surrounding tissue or in extreme cases into the bloodstream. Even after surgery, if a cyst is removed incompletely, it may regrow. Now let's talk about can epidermoid cyst be prevented or not. There is no known way to prevent epidermoid cyst, but you can prevent possible infection and scarring. If you don't squeeze, poke, stick a needle in it, or cut it open, this often leads to an infection and scarring. If it gets severely inflamed or infected, you should get medical care. We learned so many things about the cyst, but when should I call healthcare provider? Let's learn this. Call your healthcare provider right away if any of the following occur: swelling, redness, or pain around the cyst and pus coming from the cyst, then call your healthcare provider. Now we'll discuss about the key point about epidermoid cyst. Number one key point is epidermoid cysts are typically harmless, slow-growing brown under the skin. Number two, they often appear on areas with more hair, such as the scalp, face, trunk, upper back, or groin area. Number three, epidermoid cysts often go away without any treatment. If the cyst drains on its own, it may return. Number four, most cysts don't cause problem or need treatment. They are often not painful unless they become inflamed or infected. Number five, if a cyst is a concern to you for any reason, see your healthcare provider. It can be